with regard to the patients, I think adolescents and patients who start to eat out with friends, or patients who start to travel with friends, so they have not the support of the family. And so the app can really help them to assume the right doses of enzyme. Also, some parents found the application very useful because they felt to be supported, really supported, especially parents shortly after diagnosis, when they are not used to manage pancreatic enzymes. They used to phone the dietitians very often, and with the app they feel they can be a little